Bronx Borough President Vanessa Gibson, former council member Marjorie Velasquez, and also please welcome our service providers and mental health advocates. Please welcome to the stage now Dr. Warren Eng, Medical Director of Outpatient Behavioral Health at Columbia University, Athena Matos, Youth Peer Advocate, New York Presbyterian Hospital, and please welcome now the 57th Governor of the great state of New York, Governor Kathy Hochul.
Good morning, everyone. How are you? My name is Athena. I'm a hub advocate at New York Presbyterian's Uptown Hub and a proud resident of Washington Heights, where I was born and raised. Yeah. Growing up, there wasn't much discussion regarding mental health needs, let alone where to seek help, which, with so much stigma and lack of education associated with therapy, I began to internalize my feelings. I didn't know how to properly communicate what I was feeling, what I was experiencing, nor did I have the proper tools to regulate my emotions, so often I felt alone. Sadly, while we know more about mental health needs today, there are still so many young youth and young adults that are in need of help. And while we can't change the past, we can make a better tomorrow for others, which is why I'm extremely proud to be part of New York Presbyterian's Uptown Hub. The Uptown Hub is a community-based program catering to youth and young adults ages 14 to 24 across the 5 boroughs. Honestly, this is something I wish I had when I was growing up. Our goal is supporting our youth by accessing their academic, their career, and wellness goals while keeping them engaged in meaningful and impactful activities. Additionally, the hub houses psychologists on site to reduce the stigma associated with seeking help and by streamlining access to care. And because we understand mental health is a very important part of our well-being, having these services embedded in our program provides an opportunity to increase access to this care. Honestly, I could stand here all day and share all my stories with you, but one in particular comes to mind. Patient AV was a hub member and was actually part of the Washington Heights community. Not only was she dealing with substance abuse, but on top of that with mental health issues. And by collaborating with her psychologist and addressing her issues along with preventative work, once she aged out of the Uptown Hub, she was able to deal with her substance abuse, mental health, advocate for herself while maintaining a job. So as a native New Yorker and a youth advocate, every day I see the need for programs like these. Once again, it gives me great pride to be part of this program and to continue to fulfill its mission to our youth. As a hub advocate, I'm able to assist our youth in finding these services that were missing from my adolescence. Now, to speak more about her efforts to expand mental health and behavioral health care, especially for our youth, I would love to introduce our Governor, Kathy Hochul.
Let's give another round of applause to Athena Matos. She did a great job. I love her energy. Don't you love that energy? Wow. Wow, that's a 1,000-watt light bulb going off. Let's talk about mental health. Because for too long, no one did. People weren't talking about it when Athena was a young girl struggling. There's always been a stigma associated that somehow we're all supposed to get through life without ever needing help. And there's some sort of weakness or some failure as a human being if you actually say, I'm struggling, I need some help. But the reason I'm talking about this literally just days after I spoke about this at great length in my State of the State address is that I'm going to keep talking about it. And not just talk, but we're going to do something about it once and for all. That's my commitment to New Yorkers. Mental health is now one of the central challenges of our time. I've been here in the Bronx a lot. I love the Bronx. Love the Bronx. It's a great place, good energy, lots of people, lots of great restaurants I visit frequently. But also because the Bronx is leading in so much innovative work on this issue. We have great partners. And just a few months ago, I sat around with a number of individuals. I sat in a round table listening to stories of people who are struggling and their providers and what they went through. And it was, we didn't have cameras. We don't want to expose people for their raw moments. But some of our electeds were there. I know our borough president was there and others who shared that experience with me. An experience like that touches me to my soul, to know that there's people that we all represent, that we care about. My God, they're God's people living here in our state. And they just want someone to understand them, give them a hand, not to judge them for decisions they may have made. No one's perfect, but they all need our help. And I listened to them about how state government can help. And I went to another facility to unveil latest investments in our opioid settlement fund, because this is also a mental health challenge, because opioids are addictive. They can change the brain chemistry, so you cannot make the decisions you would have made before. It took us a long time to understand this. Was always viewed as a failure. And finally now there's more of an acknowledgement of what is really going on in these individuals. And I'm proud that our opioid settlement fund has delivered more money faster than any state in the nation to get out where people need it. And that's what we're going to continue to do. 2 days ago, as I said, I stood before the state legislature, before the people of New York, and I made a commitment. I said, I am committed as governor of this great state to transforming our mental health system. For too long, it's been defunded, deprioritized, and now we're dealing with the effects. Our children who are at that most innocent time, they should just be out playing and enjoying life. Our children reporting record rates of depression and anxiety. I remember going to a school in Westchester not long ago, up in Yonkers, and I talked to the school psychologist. I said, what percentage of the students, and this is elementary school, pre-K, kindergarten, up to 5th grade. I mean, an innocent, simple time in their lives, right? I said, what percentage of kids are you dealing with? It must really be the older kids, right? She said 40% of the children in this school are suffering from mental health challenges now, and depression and sadness. How can that be? We have to help these kids. And we have to reckon with it, because when someone grows up with this, never gets treated, it gets deeper, untreated illness or addiction, and sometimes they lash out and commit crimes, creating fear among the communities where they live. Let's just say that, it happens. I promise to meet this moment with the leadership and action that it deserves, because past leaders have failed too long. Today I'm going to make an announcement that shows clearly how much I intend to make that promise. And I want to thank the leaders from our legislature who joined me in this commitment. They are the true believers. They'll be with me at my side as we continue to do this. I want to thank Manny De Los Santos, our assembly member. Thank you for your leadership in this district. Truly, thank you. I want to thank our other elected officials who are here. Our borough president, Vanessa Gibson, has joined us. Luis Sepulveda, our senator, has joined us. Senator Gustavo Rivera has joined us, chairman of the Health Committee. Thank you. Assembly member Chantel Jackson, who knows a little bit about this. Former Councilor Marjorie Velasquez. Marjorie here? I didn't know if I saw you here or not. Okay. And many of our advocates, as well as Anne Marie Sullivan, the Commissioner of Office of Mental Health. Commissioners don't usually get applause like that. I mean, Commissioner, that's a big deal. I go all over the state. I mean, let's do that again for her. She deserves that. She deserves that. She works so hard. You heard from Athena, and in a few moments, we'll be hearing from Dr. Warren Ng, who's the Medical Director of Outpatient Behavioral Health here at the Columbia Medical Center. I want to thank all of them. So let's get back to what we're talking about here. I talked about New Yorkers who are suffering, wrestling with isolation, addiction, self-harm, depression. And we know it only gets worse if you don't treat it. So here's what we're going to do. I'm making sweeping investments. What we want to do is help people when they need it most. Last year, we talked about a $1 billion investment. $1 billion, first time ever, more than any state in the nation is committed to solving this problem. I knew we wouldn't solve it in 1 year. That's impossible. But we're starting to. We've increased mental health care funding by 33% in just 2 years. That's how you make up for lost time. We have targeted hundreds of millions of dollars toward outpatient community-based services. We've created over 3,500 housing units. Imagine that. 3,500 people at one time can now get the help they need in a controlled setting with professionals and make sure they don't leave until they're on a path to recovery. That's the difference we're making. We're also going to be increasing our inpatient capacity as well by 1,000 more beds and helping our kids, helping them with eating disorders and more school-based mental health clinics, because parents can't take time off their jobs and take the kids to an appointment that might be 11 o'clock in the morning. That doesn't work. You do it in school where the kids are. That's where they're showing up every day. We do it in our schools. Because guess what? These kids, and it's not just the teenagers, but they're considering suicide at rates that were never even talked about before, twice as high as a decade ago. What happened? I think historians will look back and maybe perhaps because of the pandemic, the advent of social media emerging at the same time, this is almost a lost decade when kids are twice as likely now, twice as many more children are likely to want to commit suicide. I do believe social media has been a huge factor. That's why support stands side by side with our Attorney General Tish James, and we're demanding more accountability from social media companies. It's not just for one-day press conference. We are going to be relentless in pursuing this and advancing legislation to protect children's privacy and regulate the toxic, addictive algorithms that, if you don't understand how this works, it is deeply sinister. How there are people trying to figure out how to keep your child's attention even longer and take them to dark places. They may look up something that says suicide because they're trying to figure out how not to commit suicide, and there's algorithms that tell them how to do it. That is detestable. And I'm sick and tired of those influences. The influence should be the parents, the teachers, the neighbors, the clergy, the religious foundation, peers, not these dark forces that are lurking out there trying to capture your child's mind. And that's how serious this is. And I mentioned COVID. As adults, we're thinking, well, that was so 2020, 2021, we've moved on, right? You know who does not have the developed coping skills that adults have? The kids. I've sat with kids in Brooklyn, in Manhattan, the Bronx, listened to them, let them be honest with me, and they're still talking about it as if it's still going on or it was just yesterday. They've not escaped the clutches of this time in their lives when they are supposed to be kids or at a high school meeting friends or having that prom and going to some games and graduating. They lost all that. It was robbed from them. And we as adults say, yeah, you didn't get some prom pictures, it's okay. That's not what happened to these kids. They spiraled. And they don't just come back because someone declared the pandemic over. That didn't happen. We know that now. Since the pandemic, we've seen an uptick of over 70%, a 70% uptick in kids going to school-based mental health clinics. Now that's a shocking statistic, except when you realize a lot of schools don't have mental health clinics. So these are the ones where it's available. But what about those kids that don't even have that waiting for them? What happens to them? That's why my commitment goes deep. I'm committing to provide mental health services to every school-age child who needs it. And every school that wants a mental health clinic will get one. And there's a program called the Youth Act. It's a great program. It's the first in the nation. It allows kids to stay in their schools and communities when they do need serious help, investing in them, helping them grow healthier, happier. We talk about the kids. A lot of adults are struggling. And some of them have their own kids. And their own kids see them spiraling, and the kids don't get that foundation of love and adults who act like adults because they need their own help. That's another tragedy. It's the trauma that can go on for a generation. And how does that stop? Too many adults grew up in environments of neglect without the help they need. We have people like Athena who broke out of it. That's a powerful story. And she's there helping those who've not been able to break out of it. She's there to help them now. And they can pose a danger to themselves. We have to recognize that. And that's why we have to change our behavioral health system overall. Under our proposals, hospitals will be required to screen people for mental health conditions before they're discharged and require follow-up psychiatric care and coordinate it before they leave. Don't just say, we took care of you for 24, 48 hours, we're done, you look okay, good luck. That doesn't work. That's just inviting them back again, except next time there might not be a bed available, and they'll just be out there on the streets. We need to expand also mental health courts because so many people circle in and out of the criminal justice system. Empower court-based mental health specialists who see in real time with their training, their knowledge, they know what's going on. Can't expect our court personnel and our judges to know all this. And I also want to create 200 best-in-class inpatient beds, be a model for others, and transition more people to homes, specialized permanent housing. Now, one would say, well, I have insurance. Isn't that supposed to cover everything? Guess what? They have not been doing this. Insurance companies, and many are doing the right thing, and there are others who are not. They're finding every way they can to evade covering you. You pay in all these years, your employer pays in, somebody's paying in, and now when you want to draw down and get help you need, well, we don't have a provider that's in network. These are our providers, but you call through the list of 10 and they actually don't really exist anymore. And you just, at some point you say, I've got to get back to my job. I can't spend my day trying to find a provider. That's the reality of people. That's life. No New Yorker should be deprived of care because insurance companies won't cover it. I'm going to make sure they pay. Make sure their list of providers is up to date and accurate. Those are real people, not just names and an address and a phone number that don't exist. I'm also going to keep confronting that opioid crisis, the epidemic that it is, with the urgency it demands. As I said, we've led our nation in dispersing over $190 million already, and there's more to come. But I need to bolster our workforce as well. I need more people in this field. That's a challenge as well. Now, the good news is we're talking about it. We're focusing on it. People are saying, yeah, I guess I do need help, and now the insurance company will pay for it. But what if there's no one out there because our workforce has been depleted? We lost a lot of people during the pandemic, good, hardworking people dedicated themselves to helping others. Some lost their lives because they were on the front line. Others just said, I can't do this anymore. I'm exposing my family. We know what happened to the healthcare workforce overall. We've been talking about that. But we have to expand our workforce of addiction treatment professionals and expand our outreach street efforts. Go where the people are. Distribute the naloxone and the fentanyl and xylazine test strips. We know they save lives. So we have a lot of ambition. Tackling this crisis is at the top of my priorities, which is why this is the first place I've come since we unveiled our state of the state. And I want to make sure it's happening. So starting today, I want to announce something. Already, I want more community-based hospitals to open more inpatient beds. And what I'm doing today is announcing $50 million is now available to community-based hospitals who are working to increase their psychiatric capacity. $50 million is going out. Now, what can this be used for? Literally, they can buy new property, expand facilities, cover construction costs. Because we can say we want more beds, if you don't make the buildings bigger or add more capacity, it's not going to happen. So we're really taking this down to the nuts and bolts. Money is needed to build more. It's real simple. Common sense measure that'll help us deliver real results. Well, let me close with this. I'm so proud to work with the New York City's Children's Center and the Bronx Psychiatric Center campus. This is a state-run facility. These are state workers. When I think about my state workforce, I'm proud of every one of them. But I want all of the people who work here to stand up, take a bow, and let us thank you for what you do every single day, saving lives, giving people hope. And Dr. Sullivan and all your team, they have over 550 people, dedicated, hardworking. They treat several thousand youth and their families every single year. This is a place where futures change. You give them hope, you give them love, you give them compassion. And as your governor, I could not be prouder of what you do and that you've dedicated your life to serving others. That's what we're called on this earth to do. We all have to give in some way. We all have to make this place better, and all of you are doing it in a very direct, profound way, so I say thank you. All of us agree that no New Yorker should feel abandoned, tossed aside, that there's not a pathway to recovery, and every child has to be given the tools to succeed. They have to, because that's what we're going to continue to do to make this the greatest state in the nation, because we're investing in our people, and it starts in places like this. So, ladies and gentlemen, thank you very much for participating today. Thank you for being here. And with that, let me bring up Dr. Warning to talk to you more about the work that he is doing to help our people recover. Dr. Ng.
Good morning, everyone, and let's have another round of applause for our incredible governor. So I'm grateful for the invitation to share, really lifting up the voices of the people living with mental illness that we serve every day. And especially coming on the heels of this incredible announcement this morning, but also with the governor's State of the State address, inspiring our entire state, but also acknowledging the challenges that we face. I think that the State of the State, you shared your admiration for the 26th president, Teddy Roosevelt. And Teddy Roosevelt said that if you believe you can, you are halfway there. And thank you, Governor, for believing in the greatness of New York today, but also its bright future tomorrow. And thank you for believing in the power of the people of New York when we address their behavioral health issues and their well-being head-on. I think one of the things that I'm really grateful for is I'm lucky to be a child and adolescent psychiatrist and adult psychiatrist because I have the privilege of actually treating people throughout their lifespan. And that's exactly what you've done, Governor. You've definitely looked at the entire plan and you're meeting New Yorkers where they are in their life journey. Not only meeting them where they're at in their journey, but meeting them where they're at. So providing services through telehealth, through their schools, through their clinics, through their homes, but also through their places of worship. Teddy Roosevelt also said, do what you can with what you have where you are. And that's exactly what you're doing. A year ago, I was so honored and privilege to contribute to your first inaugural Youth Mental Health Summit. And you have not stopped transforming the care for our young people of this great state since that time, and they desperately need it, as you've shared. One of the things that I'm very mindful of, and thank you so much for Athena for really opening this morning with the power of the youth advocate force. When 1 in 5 New Yorkers experience a mental health or behavioral health condition, and 50% of them start having those symptoms before the age of 14, we have to start earlier to get them the help they need so that they can fulfill their potential. And in the words of Teddy Roosevelt, believing that they can. Through the expansion of the school-based mental health programs, home-based crisis intervention programs, suicide prevention for youth of color, as well as the innovative Youth Act teams, you are sending a clear message to our young New Yorkers that you believe they can. And I think one of the things, the incredible, unprecedented investments in behavioral health in New York State have really celebrated the lifespan. So you're really looking at mothers and children with Healthy Steps programs, as well as meeting the needs of our seniors through critical time intervention programs. You're also acknowledging that the house is not a home if you don't have housing. So housing is a part of treatment. And also acknowledging the importance of our precious mental health pipeline. So really ensuring that we're more diverse, but also more equitable in terms of our loan repayment programs. I wanted to thank you, Governor, for your transformative leadership, but also believing in the power and also the promise of the people of New York, starting with the very young, but not stopping there, and celebrating their entire life so that they can fulfill their potential of contributing to this great state of New York. Thank you so much.
That concludes our program. Please remain seated while we take some photos.
Now I got a love so deep in the pit of my heart.